Tooth replacement options.
When we are discussing this topic, we have to define that we can replace tooth or we can replace the missing or damaged part of this tooth. So when we are talking about part of the tooth, I can systematize this in a way that it can be partially affected the tooth crown, and we can restore with an overlay or inlay. It can be fully affected the tooth crown, and we are restoring this with a crown. Also, we have different possibilities for buccal replacement of or changing of the shape or morphology of the tooth. We use so-called veneers, which can be composite or ceramic, and those are very thin ceramic or composite restoration materials that we put on the visible part of the tooth. Also, there is a combination between overlay and veneers, which we call veneer lay. This is a mixture of a restoration that covers the visible side of the tooth and the occlusal side, the side that teeth are contacting to each other. When we have different situation, for example missing tooth, we can replace this with a bridge. Bridge is actually structure or restoration that can replace missing tooth between two existing teeth. So the necessary thing is that we need to prepare to drill down the adjacent teeth and actually to create a restoration that has in the middle fake tooth which is actually hanging on those two adjacent teeth. This is a procedure which is not common offered in my practice because I use a lot of dental implants in my practice, and I think that this is way better decision in most of the cases. So also we have a different type of bridges. It can be a composite, ceramic, metal ceramic bridge, and what we have else, dental implants, which can be zirconia or titanium. We drill them in the bone, and this implant should wait between 3 to 6 months to integrate and connect solidly with the bone, and after that we put the crown attached to this implant. Also we have removable restorations or removable prosthesis. It's very common to use those removable partial prosthesis in implant cases while we are waiting for the implant to integrate. Also when the patient has some 3 to maybe 8, 9 missing teeth, and in this way we can use this removable prosthesis. Maybe for a long term, if it's not possible for this situation to put implant. Also there are fully prosthesis that we put in the patient which are totally edentulous. In this situation the prosthesis are restoring the teeth and the gum part, and the patient can eat with this. Also they can remove and clean it. Something which is very popular nowadays is a little bit more advanced to this, that we can put multiple implants, and on top of this we can put so-called prosthesis, and we can screw to the implant so the patient doesn't have the possibility to remove them or they to move around in their mouth.